Orygen's story is one of the most exciting and influential health stories ever to come out of Australia.
In cancer, in heart disease, in every other major sort of non-communicable disease, you had the imperative to either do prevention or to intervene early. And in mental health, it was exactly the opposite. You just waited until people got really, really sick. It needed a radical change, a paradigm shift. Here at Orygen, we've built an ecosystem of 1,000 people working on several aspects of youth mental health: clinical care, research, policy development, education and training, global reform, and digital mental health. So it's a unique constellation of resources and expertise, but we're working with partners with similar expertise in other parts of the world as an international front for reform in youth mental health. We are a bit unique in terms of medical research institutes, that we take on this much broader portfolio of responsibilities because our motto is research for reform. We're not just doing research to publish papers in journals. We want to see the world change in a positive way. And because of that, we have to have other elements apart from just straight research programs or even basic clinical care. We need to develop something that's more than the sum of the parts.
Sort of fell in love with the work that was going on around mental health, and in particular youth mental health and suicide prevention here at Orygen. It was actually really refreshing as a young female academic to be working in an environment that had such energy, that was very dynamic and was willing to give things a go and do things differently.
The thing that really just grabbed me straight away was that compared to the other places in the mental health system, this was the only place that had any optimism that the lives of the people who are coming here could be impacted positively and that we could actually make a real difference.
I think when people outside of our organisation think of Orygen, they think of us as world leading, definitely cutting edge in our research. They know that we've got clinical excellence here and that our research is always pushing the boundaries.
Orygen constantly building new models of care, producing the evidence about what works, has been an enormous contribution to our country.
On the global stage, we're really pushing the boundaries, and that I feel really proud to work here when we're doing that.
The staff that were involved and their attitude, the way that they treated me, even in their interactions between each other, they created a really positive environment.
We're faced with a 50% rise in prevalence of mental ill health in young people over the last 15 years. The problem has deteriorated as we've been doing it, so we've got to redouble our efforts, and the revolution has to continue.